Asalamoalykum friends and colleagues. Welcome back to my channel, which is all about healthcare business and dentistry. I am your host Dr. Suhail Shabir Ahmed, and today we will continue to discuss in the second part of the series, managing dental pain. Uh, last in my last video, I introduced you to the AIMA system that I use myself, and we discussed the first element of that system, that is ask. In this video, we'll be discussing I for identify. So let us begin. When the patient comes to us with pain, and I'm specifically talking about pain related to the oral cavity, dental teeth, and face. When the patient comes to us with pain, we must first assess whether this pain is dental in origin or is it non-dental in origin. If the pain is dental in origin, we must consider all the types of pain associated with teeth. But if, for example, and for that, I will show you a chart. These are the types of dental pain which I'm going to be discussing in a while. When the patient says the pain is of dental origin, we must assess which one of these is the cause. Similarly, if the patient says that the pain is of non-dental origin but is stabbing in nature, we should consider trigeminal neuralgia or neuralgia. There are other forms of neuralgia also. If the patient says that the pain is non-dental in origin and also non-stabbing, then we should consider orofacial pain. And this is the chart that I will be discussing in a while about the orofacial pain. When we are talking about dental pain, we have to assess the most common forms of dental pain that the patients come to us with. Mostly dental pains are acute in nature, and if the patient comes to us with pain, we must ask the patient whether the pain is short, sharp shooting, or is it dull, throbbing, or persistent. If the pain is short and sharp shooting, we must next ask our patient, is it triggered by hot, cold, or sweet? If yes, then we should consider that there is exposed dentine from which may be due to gingival recession or a lost filling or a dental caries. But if the patient says that the pain is triggered on biting, then we should consider a loose filling, a cracked tooth or cracked cusp, or fractured tooth. The most common fracture that comes to my clinic are the vertical fractures, which mostly progress from the top of the crown to the root. Then, if the patient says that the pain is dull, throbbing, or persistent in nature, then we should consider whether the pain is localized and the tooth is tender to percussion or not. If this is true, then we should consider periapical pain or sinusitis. Sinusitis associated with dental pain is less common as compared to sinusitis from allergic rhinitis. It is very much possible that if the dental pain progresses, it can result in sinusitis also. But the more common cause of sinusitis is allergic rhinitis or allergy, as we call it, dust allergy or pollen allergy. And we must differentiate whether this sinusitis is due to a dental problem or whether is it due to an allergic reaction. Next, if there is also inflammation, we should consider an impacted tooth, like for example pericoronitis. In case of pericoronitis, we have the swelling gingivitis of the retromolar pad area and the area associated with the tooth, mainly the wisdom tooth, lower wisdom tooth. Or this pericoronitis is usually due to food infection and results in localized pain and localized inflammation. If the inflammation is generalized, or if we see necrosis, we should consider acute necrotizing ulcerative gingivitis. If the pain is local, yet it is diffuse in nature, then we should consider dry socket. A very common reason for dry socket that comes to my clinic is the patient's inability to follow the proper post-extraction instructions, and especially the most important instruction about warm water with sodium chloride gargles or salt water gargles. Another form of local diffuse pain could be temporomandibular joint problem or TMJ disorders. These are the most common acute pains or dental pains that we come across in the dental clinic. Now, let us discuss the orofacial pains, which are mostly chronic in nature. If we talk about orofacial pain, we have three types of pain: persistent idiopathic orofacial pain, neurovascular or tension type, and neuralgia. When we talk about persistent idiopathic orofacial pain, it could be due to TMJ pain or atypical facial pain, or it could be a burning mouth syndrome. When we talk about neurovascular and tension type, this includes tension type headache, migraine, or cluster headache, also known as autonomic trigeminal pain. Third form is neuralgia. This could be trigeminal neuralgia, atypical neuralgia, or post-herpetic neuralgia. Or it could also be post-traumatic neuralgia, also known as causalgia. These are the common types of dental and orofacial pains that we must consider uh, in order to identify the correct type of pain, so that we can progress on to the treatment. In the next video, I'll be discussing with you the treatments for these pains. If you like this video, give it a thumbs up. If you found it to be useful, do share it with your friends and colleagues. Don't forget to subscribe to my channel, and don't forget to push the bell icon. Do inform me of your feedback through the comment section, and you can also follow me on Facebook, Instagram, and Twitter. The links are in the description below. Asalamoalykum.